Each year in North America, over 46 million teeth are extracted. Unfortunately, only 353,000 of these 46 million extractions are immediately followed by ridge preservation procedures, even though it has been shown that when bone grafting material is not placed, bone resorption starts almost as soon as the tooth is removed. In fact, without grafting, your patients will lose an average of 40 to 60% of their crestal ridge within 6 months post-extraction. This loss of bone structure becomes a cascading problem, as the strength and quality of the underlying bone is the foundation upon which the eventual restoration will depend. Why is it that so few dentists do ridge preservation procedures immediately following tooth extractions, even though preserving bone in this way enables a better, more predictable patient outcome? The reality is, many dentists simply think the procedure is too complicated. They know that most bone graft substitutes are tricky to use. They must be placed in a bowl, mixed with blood or saline, gradually transferred to the defect site, and then be completely covered with a membrane to keep the grafting materials in place. When surveyed, general practitioners said that an ideal bone grafting material wouldn't be like this at all. It would be a convenient, easy-to-handle product with a malleable material that hardens in the defect and reduces the need for a membrane, which is exactly what Sunstar's GUIDOR easy-graft classic alloplastic bone grafting system offers. GUIDOR easy-graft classic alloplastic bone grafting system is ideal for ridge preservation and other bone grafting procedures. While this product should not be used in pregnant or nursing women, it is an excellent choice for dentists who focus on atraumatic tooth extractions and minimally invasive procedures and believe that placing bone graft material shouldn't be complex. With GUIDOR easy-graft classic, placing the bone grafting material is a lot like placing amalgam, a technique with which you are already quite familiar. The GUIDOR easy-graft classic alloplastic bone grafting system eliminates all of the guesswork regarding which liquids to add. Everything you need is right there in the kit. You get a syringe full of coated, pressure-resistant granules and a liquid activator called the BioLinker. Once mixed, the grafting material takes on a putty-like consistency that is syringed directly into the socket and very easy to mold. Just prep, dispense, and shape. It's a moldable material that can be placed in defects of any shape. Within about a minute of coming in contact with the patient's blood, the GUIDOR easy-graft classic material forms a stable, porous graft, which encourages bone regeneration. This brief delay gives you time to pack and shape the material to the contours of the defect before hardening occurs. In many 3- or 4-wall defect cases, it does not even require a membrane. Soften the syringe and harden the defect. GUIDOR easy-graft classic is a 2-part system comprised of beta-tricalcium phosphate granules with an extremely thin, degradable polymer coating, plus the BioLinker liquid activator. BioLinker is a non-volatile solvent that is 100% synthetic, fully resorbable, and has been successfully used in various medical products for over a decade. This unique combination of materials provides the foundation for easy preparation, dispensing, and shaping. When mixed, the BioLinker softens the polymer coating, thus creating a sticky surface that can be compressed and shaped. When the material comes in contact with blood, the BioLinker begins to flush out of the material, and the graft hardens into a stable, porous scaffold of interconnected granules. GUIDOR easy-graft classic is a safe and easy material to use, and dentists give it very high marks. For example, in a blind product evaluation conducted by an independent market research firm, 80 U.S. dentists tried the GUIDOR easy-graft classic alloplastic bone grafting system for the first time, completing a total of 300-plus cases. When surveyed 3 and 6 months later, 95% of respondents said that there had been no patient complaints, and 97% said that there had been no signs of infection or inflammatory reactions. In addition, up to 90% were satisfied with the clinical outcomes, and 90% confirmed that GUIDOR easy-graft Classic simplifies bone grafting procedures. In summary, by grafting the sockets immediately after a tooth extraction, you reduce the bone and soft tissue shrinkage and allow for more optimum placement of implants or fixed prostheses. Engineered for easy placement, Sunstar's GUIDOR easy-graft Classic Alloplastic bone grafting system is a patented bone grafting solution that is designed to help you perform bone grafting cases with confidence. GUIDOR easy-graft Classic greatly simplifies the handling and placement of bone grafting materials, and in many cases, even eliminates the need for flaps and membranes.